Hi, welcome back. My name is Josh. I'm with Fisher's Health Department, and today is Tuesday, July 13th, 2021, and I'm here with our weekly COVID-19 community updates. So in terms of our community risk rating scale, we are in the same level 1 low risk category. That is our green color category. This is due primarily to our primary metrics, where we look at testing positivity rates and case incidence rates. Our Hamilton County unique individual testing positivity rate as of this morning was at 4.6%. Our Fisher's testing site positivity rate is at 4.46%, and our case incidence rate is at 3.52. So all of those are in green, and overall the primary metric area is in green. And as you've heard quite a few times over the last several months, our secondary metrics, where we look at contact tracing, test turnaround, testing availability, all those metrics remain in green. And then our tertiary metrics, looking at hospital system capacity, that remains in green as well. There's been just a slight indication of an increase in ICU admissions for COVID in District 5. That's Hamilton County and the surrounding counties, the IDOH District 5. But overall, everything remains rather stable. Now, I do anticipate a bit of potentially our positivity going up next week, and potentially the case incidence rate going up next week. That's because looking over on our previous number of cases in the past 7 days, which also includes cases that came out of the July 4th holiday, there's slightly higher numbers than what we've seen over the last few weeks, but not terribly so where I would anticipate us moving up a risk rating level. But it does give an indication that there still is this risk of transmission within the community. So even though we're in the green category, do continue to take every precaution that you can. Do go out and get your vaccine if you haven't had the chance to get vaccinated yet. If you ever need any assistance with that, as always, call us 317-595-3211. We'd love to discuss with you opportunities about getting your COVID-19 vaccine or answer any questions you may have about it. But overall, we remain in the level 1 low risk category, but there still is the opportunity for transmission within our community. And in terms of COVID cases, to date for this calendar year, we know of 42 variants of concern. So these are new variants separate from the traditional strains that we saw earlier in the pandemic. And the most predominant one that among those 42 cases in our Fisher's community is the one colloquially known as the UK variant, although we have seen 5 cases of the Delta variant as well. And in addition, we've also had 51 breakthrough COVID cases. So these are instances where individuals are fully vaccinated, so they're 2 weeks past their second dose, or also fully vaccinated after their Johnson & Johnson dose. And so we've had 51 individuals within our larger community that have contracted COVID and had a positive COVID test after being fully vaccinated this calendar year. So please do continue to take every opportunity you can to keep yourself, your loved ones, and your family safe. That is, you can do a large part of that by getting the vaccine, but also other mitigation strategies that we've discussed in previous videos and all of our information online. So in terms of our vaccination rates, to give you an update, we are currently at 72.7% of 12 and older eligible residents having received at least their first dose vaccine, and 67% are fully vaccinated. Now, these vaccination numbers have just increased incrementally over the last few weeks, so there's a lot of slowing uptake in terms of the vaccine. We do encourage everybody to consider and to go out and get the COVID-19 vaccine. They are highly effective and efficacious against contracting the COVID, but also highly effective against getting severe forms of the disease. So please do take consideration about getting the vaccine. If you have any questions on that, any questions about COVID at all, or any other general health department questions, do reach out to us. We would love to discuss and answer any questions that we can on any health related topic. Thank you so much. I hope you have a wonderful day, a wonderful week, and I'll be back next week with another update. Stay safe. Bye.